Over the last 12 years that we've been running our service at Imperial, we've certainly come to appreciate the long and hard road that people with POTS and their families and carers have to manage before they get to us. And we feel that POTS UK is an invaluable resource for both us and them.
The patient educational resources, the website and the information for healthcare professionals is invaluable.
And we find POTS UK very useful in the fact that we can refer patients to their website for lots of information and support in the clinic after they've been seen by us.
POTS UK are run by phenomenal individuals who are beautiful human beings. So all credit to the trustees and the management structure within POTS UK. We support you.
The patients are all out there. They need support from a specialist, and I'm very much hoping that in the future we get more interest and knowledge in the diagnosis and treatment of these patients in the community.
The POTS UK charity is providing a fantastic service for the patient group, but also it provides education for healthcare professionals. So on POTS Awareness Day, we really do want to raise awareness of POTS. We need much more research in this area. We need greater education of healthcare professionals, but also in the wider public as well.
And I just want to encourage anyone, if you think you have the symptoms, to ask your GP whether or not they think it could be POTS. For me, it usually manifests itself in my blood pressure dropping very quickly, and sometimes, embarrassingly for me, hitting the floor. And if that sounds familiar, it's really important that you seek out help, because the more you know about your condition, the more you can manage it, and then the more you can do with your life.
POTS UK is a fabulous charity with an incredibly useful amount of information for patients about postural tachycardia syndrome and allied autonomic dysfunction. The website has tremendous resource for patients in terms of information about both non-drug therapy and drug therapy of the condition. We also have a lot of information on the website for clinicians who need to be better informed about this disorder. And I think one of the most useful things is to see the patient stories, which often are heartbreaking, and we clearly need to do a lot more to help individuals with a diagnosis of POTS and autonomic dysfunction.
Well done, POTS UK, for raising awareness and supporting people with POTS. It's absolutely vital that we change the current narrative. The narrative that people with POTS often wait many years for their diagnosis, have frequent dismissals, and even when they think they've got POTS, having really poor access to services. It's only through raising awareness that we can firstly access better research streams in order to understand what causes POTS, and therefore look towards treatments that are more effective than the ones that we've got.